be jabbed. Well, he was interviewed by Mike Graham last week, but big developments since then. So I'm delighted to welcome him to the studio once again. Good morning, Steve.
Morning, Julia. Thanks for having me on.
Really, I have to say, I think so many people and so many of my Talk Radio listeners would have been clapping you again and cheering you on for the way you spoke to the Health Secretary so calmly, with all your expertise and all your experience and frankly your heroism working on a COVID ward long before we had vaccines and the like, and any other, limited PPE, etc., in the first wave of this COVID pandemic, and yet you're now facing losing your job because you've not been jabbed. We're going to go into a bit more of that, but first of all, there have been some reports over the weekend suggesting that the government might pause, delay, possibly by 6 months or so, the decision to sack people like you for not being double jabbed by the 1st of April. Do you welcome that, or does that just push the can down the road?
I think the government's got to think about what they can do without looking too embarrassed or awkward. I would understand them saying a delay is the furthest they feel they can go. I clearly think a delay is the wrong thing, because I think a mandate's the wrong thing altogether. But I think that if they do put it further six months down the line, they won't come back to it.
There'll be a lot of people listening to this who, like me, are massively opposed to mandatory jabs, certainly for the wider population. I still feel incredibly resentful about why you need them to travel, and I mean, certainly vaccine passports, I think, are genuinely an obscenity in a free liberal democracy. But there'll be a lot of people also who will say, but if you're working with very vulnerable people, the people in hospital, by definition, they are sick, they're vulnerable. An awful lot of them are very elderly. They are high risk. And even if the jab doesn't completely protect them, obviously, you could still get COVID, you can still pass it on. Anything extra you can do to give extra protection to yourself and therefore to the people you care for, it would be the right and moral thing to do. So why don't you just get the jab, Steve?
Thanks for the question. That's good. So there's a few things to consider here. One is the data we've got on onward transmission, and the benefits for being vaccinated or unvaccinated is based on community studies. It's not based on studies for doctors and nurses and staff working in hospitals. When you try to translate that information across, you can see there'll be lots of differences. One of the most important things is if you're symptomatic or you're feeling unwell, you don't go to work as a doctor or a nurse. And we know that asymptomatic spread is rare. The World Health Organization's technical director, Dr. Fauci himself, saying, asymptomatic transmission is not the problem, it's not the issue.
But there's a small percentage, but the idea that these adverts we had, didn't we? 1 in 3 people you come in contact with could be giving you COVID. Well, yeah, if they're out and about and well enough, they're not giving you COVID, basically.
The data now is looking more like about 2 or 3% of transmissions in this category. So that's one thing. Then doctors and nurses are wearing PPE. They're in well-ventilated areas. They are not sitting in close contact as household contacts are. They're not like couples sharing a bed together at night time. So there's massive differences. The other side to it is that actually within hospitals, 90% of the transmission from the Cambridge study of COVID to a patient came from another patient.
Oh, really?
Yeah.
That's yes. It's just the infection control within the wards.
The infection control within the wards is the primary issue. It's the primary issue, and the staff shouldn't be scapegoat for that.
And that's what a lot of people feel, isn't it? Now, a lot of people told you need to follow the science, and the science says this jab it saves lives. We can see the stats in terms of the protection against hospitalisation and against death, and particularly obviously most crucial for those who are highly at risk, over 70s, people in their 80s and 90s, who are the people who largely die of this. It can make a real difference. In terms of your sort of duty of care to those people, even if it was just 2% difference, is that not enough for you?
If I could be sure I got a 2% difference, I'd take it.
Yeah.
And doctors are looking for those 2%, those 1%, those 0.5% all the time. And you're trying to balance different things when you're looking after patients. The idea that 5% of the workforce in healthcare, and we must remember it's not just NHS, it's the private sector as well, and it's people who are not just frontline workers but staff in offices as well, is those people are recognised as professionals. They've been accepted for having had the training and done the years to work out what's the best for their patients. Over the last couple of weeks, I've been in contact with thousands of healthcare workers at the march on the weekend, people coming up to me.
There was a very, very big protest march in London and many other cities as well.
And the big thing that really touches me again and again is the concern that staff members have about side effects from the vaccine.
Yeah.
Now, this is, I think, the elephant in the room that no one's talking about. If I started off by talking about side effects for vaccines, I would most definitely have been labelled an anti-vaxxer and probably not put out anywhere at all to speak.
Yeah.
But that's what the staff are concerned about.
And that's because that's what they are seeing. And there's no doubt at all there has been an underreporting of those side effects. I know people myself who spent 5 days in hospital as a result of having their jab. No other reason, a reaction to the jab. And again, I'm pro-vaccination. I'm double jabbed myself. But an unwillingness to talk about this, the myocarditis, the heart inflammation, particularly for young people, my concerns about teenagers getting vaccinated is based on these side effects. And we're constantly told by the media, oh, well, these are tiny. But in fact, for lots of age groups, the risk of COVID is also tiny, which is why the JCVI, the body that decides on immunisation, initially argued against giving the vaccine to under 18s on the basis that they didn't need it in the same way, and the balance of risks was so finely tuned it wasn't worth giving them. It was a political decision to give the vaccine. So unless we're calling the JCVI anti-vaxxers, it's a fair and reasonable point to make.
To sort of go on with that point, I saw a Freedom of Information request answered by the Office of National Statistics last week, where they requested the numbers of patients who died or people who died with only COVID-19 on their death certificate. And I know as a doctor filling out death certificates that we only tend to put down what we think or we're sure are contributing factors. So certainly people who are overweight or have got mild obesity, we might not put that down on a death certificate. But where only COVID-19 was recorded, there have been 3 patients in the UK under 20 who've died from COVID.
Yeah, I mean, that's it. Those who have died have got a number of often very serious underlying conditions, being treated for cancer and things like that as well. And again, that's not to say that no one cares about the people who've got underlying. No. It's just we are talking about whether or not people need this jab or not. When you spoke to Sajid Javid, the Health Secretary, you were so calm and reasonable. You weren't sort of, a nutter with a placard. I mean, that's what he would have thought, and therefore he had to take you seriously. And the fact that you had been working on the front line, someone we've been applauding, we stood on our doorsteps, 8 o'clock at night in those early months of the pandemic, who was there on the front line working, and you say you've tested positive for COVID. You don't remember ever having it. You didn't get ill, but you clearly have antibodies to it. Your argument is that you're as safe as anybody else looking after your patients, and the decision to sack you will actually put patients, not just ruin your livelihood and your career, but put patients at risk, because we've already got 100,000 NHS staff missing in terms of the vacancies, and we're looking at tens of thousands more losing their jobs at a time when we are facing a huge backlog of NHS treatments.
Yeah. So staff are under pressure, and when staff are under pressure and feel a bit unwell, they're much more likely to come in and do their shift and stay at home.
Yeah.
If you double the number of people who are missing from the NHS's staff, you're going to drive more people to go into work when they don't feel very well. That's going to increase transmission.
Your message to the government about right now today about this policy. We've seen social care staff in care homes losing their jobs, many leaving before they were sacked. And they were actually free to go to the NHS, interestingly, for this time. But we know that's had a massive impact on care homes. They simply haven't got the staff, care homes closing, unable to take new residents because they're now stuck in the NHS, causing bed blocking, making it harder for other people to get treated. I mean, the knock-on effects are huge and will probably cost lives of patients who don't get treated as a result. Government ministers, I know, listen to this show. I know because they text me and message me about it all the time. What would you say to them right now?
You've got to do impact assessments if you're going to do things like this. You've got to look and see whether a policy is really going to bring a benefit and look at the wider implications. The whole of lockdown, there is such a big question as to whether lockdown helped overall the health of the nation. It's a very uncomfortable question to ask, but it needs to be asked if you're going to take such measures.
When we say follow the science, we actually do need to actually follow the science.
And but follow the science or trust the science is also a very odd phrase, because really science is all about questioning what somebody else says. and
asking for evidence
and challenging it, saying, but this says this, and how can you explain that?
I think we need more Steve James involved in policy making, and I think a lot of my listeners would agree. I so applaud your stance and your willingness to stand up for what you believe in, and I really appreciate you joining us. Thank you very much.
Thanks very much for the time, Julia.
Dr. Steve James, NHS consultant. Well, until April the 1st. Anyway, 9:35 is the time. This is Talk Radio.